Hi guys, today's our topic is cardiac output. So what is cardiac output? Cardiac output is the amount of blood ejected by each ventricle per minute. So each ventricle per minute. So how many beats per minute? 72. And how much volume of blood will be ejected per beat? 70 ml. So we'll see that. So cardiac output is equal to stroke volume, which is 70, and heart rate, which is 72. So 70 into 72, around 5040, that is near approximately 5 liters per minute is the cardiac output. And cardiac index is cardiac output in comparison with body surface area. So 5 liters by 1.74, around 2.8 plus or minus 0.3 is the cardiac index. Now, what is ejection fraction? Ejection fraction is the amount of blood ejected from end diastolic volume. So it is usually 60 to 65%. Usually end diastolic volume is 130 ml, end systolic volume is 60 ml. So 130 ml minus 60 ml by 130 ml is the ejection fraction. And coming to the distribution of cardiac output, this is not based on the weight of the organ, it is overall blood flow of the blood flow to that organ, that is cardiac output to that organ. So the majority is by 1500 ml per minute to liver, followed by 1300 ml per minute, followed by kidney, and followed by skeletal muscles 900 ml and brain 800 ml, the heart with the minimal 200 ml, and the skin, bone and GI tract 300 ml. So all this together will make 5000 ml per minute. So majority is going to the liver and the next is kidney. Now coming to the factors maintaining cardiac output. So cardiac output is usually, with the definition, cardiac output is equal to stroke volume into heart rate. So the factors affecting stroke volume and the factors affecting heart rate. So stroke volume is more means cardiac output is also more directly. Similarly, heart rate is more means cardiac output is also more. Okay. So now we'll talk about stroke volume. What are the factors affecting stroke volume? So these are the factors I am talking is affecting stroke volume. So we'll see. One is venous return. So blood flow to the heart, the return of blood to the heart, which if it is more, cardiac output will be more. Force of contraction, how much the force of contraction the ventricle is contracting. And peripheral resistance, the resistance in the aorta and in the arterioles. So these all determine the stroke volume and heart rate. So these are the factors. First we'll talk about what are the factors that affect venous return. So what is venous return? Venous return is nothing but it is the amount of blood coming to the atria. Okay, and more the venous return, more will be the cardiac output. How? So venous return is more means more blood in the atria that goes into the ventricle. So more the ventricular blood flow, more the ventricular blood volume, more the stretch of the ventricle. So more the stretch of the ventricle means more the force of contraction. We'll talk about this force of contraction in preload, which is nothing but the venous return. And what are the factors that affect this venous return? Okay, let us think that. If this is the heart and we are talking about the right atrium, venous return, let us think that. So the venous return depends upon one, blood volume. If the blood volume is low, definitely venous return is reduced, cardiac output is reduced. The second one, venous tone, the tone of these vessels. If the venous tone is not properly there, let us think that veins are dilated. There occurs pooling of the blood and the blood don't return into the atria. And venous pressure, the pressure gradient between the veins and the atria should be favorable so that blood moves from the veins into the atria. And respiratory pump, This respiratory pump during inspiration favors venous return. We'll see that. And muscle pump. Muscular activity will cause compression of the veins and that causes the movement of blood upside. Now coming to the blood volume. So venous return is dependent on blood volume. So more the blood volume, more the cardiac output. Let's think that there is an hemorrhagic shock where there is blood volume loss, which is also a hypovolemic shock. So that decreases cardiac output. Venous tone directly proportional to venous return, which is directly proportional to cardiac output. Venous pressure. Pressure in the venules is 12 to 18 mmHg. When comes to the great veins, 5.5. When comes to the junction of vena cava and right atrium, 4.6 and almost 0. So the pressure gradient 12 to 0 is favoring the movement of blood towards the atria. And respiratory pump. During inspiration, what is happening? Expansion of the thoracic cage is occurring. So negativity in intrapleural pressure. So the diameter of inferior vena cava is increased. I can say that it's like a vacuum effect. And also the diaphragm is descended down, which increases the intra-abdominal pressure. So compression of abdominal veins occur. So both this dilatation of vena cava and compression of abdominal veins will cause the increase in venous return. So increase in cardiac output. Muscle pump. More the muscle activity, more the venous return. So here is the contracted muscle and the blood is pushed up as the valves open. When the muscle relaxes, the blood tries to come back but the veins close. So in this way, contraction and relaxation of the muscle causes the blood to move towards the heart. Force of contraction. As we mentioned, force of contraction is directly proportional to the cardiac output and depends on two factors: preload, which is nothing but venous return, and afterload, which is the load in the aorta. Preload. So preload is explained by a law called as Frank-Starling's law. What it says is force of contraction is directly proportional to the initial length of the muscle before the contraction, and that too, that initial length of the muscle should be in physiological limits. I will give you an example. I stretch a rubber band up to this extent and release. That generates the force of contraction. And I stretch it up to this extent. It generates bigger force of contraction. And if I stretch beyond its limit, it will break. So similarly, ventricular muscle, whenever the blood is pulled in, it stretches. If that stretch is within the physiological limits, it contracts back with more force of contraction. So more stroke volume. So more the preload, that is nothing but more the venous return filling. So more stretching, more force of contraction. Afterload. Afterload is the inversely proportional to cardiac output. What is happening in the afterload is nothing but if this is the ventricle and if this is the aorta, if the pressure in the aorta is more, the output is reduced because it is opposing the outflow. So pressure in the aorta and pulmonary artery. Coming to the peripheral resistance, if the resistance is nearer to the heart, we are calling that as afterload. It is away from the heart, like at the arterial level, we call that as peripheral resistance. That is also similar to afterload, so inversely proportional to cardiac output. Heart rate, simple. More the heart rate, more will be the cardiac output. So directly proportional. And sympathetic nervous system increases cardiac output as it increases heart rate. Parasympathetic decreases heart rate, so decreases cardiac output. Coming to the measurement of cardiac output, measurement of cardiac output can be done experimentally, direct method and indirect method. So direct methods previously we used to do for the animal experiments, either using a cardiometer or by using a flow meter, where the vessel is cut and is connected to this cardiometer or flow meter. Indirect methods, our prime target is Fick's principle, and other than this we have dye dilution technique. thermodilution technique, ultrasonic Doppler transducer, and Doppler echocardiography and ballistocardiography. These are the methods of recording cardiac output, but our concern primarily is Fick's principle. What Fick's principle states is amount of substance taken by an organ is equal to blood flow per minute to that organ and AV difference of that substance across that organ. So modify this. This is our cardiac output. So cardiac output is equal to amount of substance taken by AV difference. So our concern is this. Oxygen consumption method. So oxygen consumed by lungs is 250 ml per minute and arterial is 20 ml per 100 ml and venous is 15 ml. So cardiac output is equal to oxygen consumed by AV difference. So oxygen consumed is 250 and AV difference is 5 by 100. So 100 goes up. So we are getting 5 liters per minute. Similarly, carbon dioxide. 200 ml per minute is removed by the lungs. 56 is the arterial blood concentration and 60 is the venous blood. So 200 by 4 into 100, we are getting 5 liters per minute. This is how cardiac output is measured using Fick's principle, either taking oxygen or carbon dioxide. Thank you for your patient listening. Bye.